Good morning, good afternoon, good evening, everyone. Thank you so much for joining us for this wonderful session on children and caregivers in Women in Transport Conference 2021. I'm so excited because today we have an amazing panel who will be introducing themselves shortly. My name is Penny Ndegwa, and I'm the founder of Moms Kenya, a social enterprise that advocates for children-friendly cities in Kenya and beyond. I'm so excited to have all of you, and I'm calling without much ado, I want to invite my panel to introduce themselves, starting with Angela. Angela, over to you.
Hi, I'm Angela Franke. I'm a professor for cycling and sustainable mobility at the University of Kassel in Germany.
Thank you so much for being here. Owen Mwaura.
Hi, I'm a research student at the University of Cape Town. Focus on transport and mobility. Thank you so much.
Thank you. And then we have Sam.
Good afternoon, good morning, everyone. I'm Sam Bambaza, Executive Director, Hope for Victims of Traffic Accidents. HOVITA is a local NGO focusing on road safety in Uganda. Thank you.
Thank you. Gretchen.
Hi, everyone. I'm Gretchen Wilson-Prangley. I'm the founder and CEO of Play Africa, and I'm joined today with my colleague, Shwiko.
Thank you.
Hello, everyone. I'm Shwiko Kanyoka, and I'm a program manager at Play Africa, leading the placemaking programs. Thank you.
Thank you. Basil.
Hi, everyone. Good morning. Good afternoon. My name is Pascaline Basil. I'm a researcher and a PhD student based at the Institute for Development Studies, IDS, University of Nairobi. Thank you.
Thank you so much. I'm so excited to have everyone on board, and I cannot wait to see your amazing presentations. And I'd like to ask the audience that feel free to ask any questions. You can type it in the chat, and then you'll be able to respond at the end of the session. So without much ado, I just want us to dive in the presentation. And without much ado, I'd hand it over to Pascal from University of Nairobi to share with us her case study, the study that they're working on in Nairobi, Kenya, on school mobility. Carry on, Pascal.
Thank you so much, Penina and everyone. Like I said, my name is Pascaline, and I'm a researcher at the Institute for Development Studies. At the Institute for Development Studies, we carry out development research that cuts across all the sectors, and it's a multidisciplinary institute. Back in 2014, when I started my master's at the Institute for Development Studies. And I remember I used to take public transport every morning and every evening, coming to class and going back home. And I also remember very well that I was expectant. I was an expectant mom at that time. And it was not an easy journey, and it made me start thinking about how we move from one place to the other as women, expectant, accompanied by kids. And like Penina has just said, that kids have to be accompanied in public spaces, even in schools as they move around. And in my research, I started thinking about solving all our public transport problems. Traffic in the morning, and in the evening, you are getting late, you need to go back home to breastfeed. And it even made me start thinking of why don't we have the lactation facilities at the universities, even like the University of Nairobi, because that is, we are at the master's level, some of us are mature enough, we are mothers, we are wives, we are everything. So it made me start thinking of, can we have some breastfeeding facilities where we can even bring our kids along, because we need them in the process of our journeys and even in life. So in the process, 2 years ago, we started thinking of the mobility, safety of school-going kids, even in public spaces. How do kids move from one place to the other? How are their safety concerns addressed? And we came together with a team of colleagues at the Institute for Development Studies. That is one, Dr. Anne Kamau. We have Eric Manga, and we also shared our idea or our views with colleagues in Ghana, University of Cape Coast, that is Dr. Regina and Kwabena, and we said, why don't we research? Why don't we start talking about issues of safety, issues of mobility for school-going kids? And that is now how our research was born. And when you talk about children and their caregivers, I asked the question, who bears the responsibility? Who has the biggest responsibility of caregiving? And I'll mention this at the end of the presentation. We found that majority of the children walk to school because our research was more the schools that we talked to were public schools where school transport is not provided for as such, unlike in private schools. And we realized that most of them are accompanied to school. How is accompanying done? You realize in the morning, as a mother, I have to walk my kid to school. Either I walk the kid up to a place where he or she can safely cross the road, or I cross the road with the kid, or I also take them to school. What happens to those kids who are supposed to come back to school during the lunch hour? What happens to them? The same thing has to be done. In the evening, someone has to go and accompany them because when you look at our infrastructure, it is not very accessible. It is not safe. We have instances where we have the traffic marshals and the wardens who assist, but this is not, it is not everywhere in all the schools. And you realize, I think at the end of the research, you are asking ourselves, what is the cost of accompanying the children to school? I am running a business in the morning, so I have to take some hours off. I start my day very early in the morning, 5 in the morning, so that I take the kid I prepare the kid, we begin there. I take the kid to school. Then after that, I rush to open my business. Another mother will rush to place of work. Another one will go to school. That kind of understanding. So we were asking ourselves, what is the cost of accompanying kids to school? I will run you through the presentation. Allow me to share my screen. I hope I can quickly do that. I'll be presenting on behalf of my team. That is at the University of Nairobi and University of Cape Coast. So I hope we can all see the screen.
Yes, we can.
Please?
Yes,
so
we can.
Our project was urban spaces design, mobility and transport safety of children. And this was a comparative study of Nairobi and Kumasi cities, as I mentioned. I also mentioned that we had the team members. We have Anne Kamau, Eric Manga, Regina and Kwabena. And in Nairobi, we covered 2 schools, and these were public schools. We had envisioned to talk to also private schools, and because of COVID, we did this study when COVID just struck, and we were not able to access the schools. Anytime we went back to schools, COVID was an issue, and it also came to a time when the schools were also doing their examinations, that is the Kenya Certificate for Primary Education. And it was, those in Kenya know that during that time, visitors are not just allowed in school. So we only managed to talk to 2 public schools in Gara area. And that is what is being shown in the map. So this is just a map of Nairobi and the schools in Gara. We have 1, Kaloleni, and the Riverbank Primary School. In Ghana, the schools, they talk to both public and private schools, and the schools they call Chapo Municipal Assembly and the Kumasi Metropolitan Assembly. And why the focus again on urban spaces, mobility, access, and student safety? You realize that African cities are increasingly urbanizing. Urban environment places for young families and new generations. Like we said, that kids are moving in public spaces. And also realize when you talk about safety, globally every 4 minutes a child dies from a road accident. Sometimes when I talk about issues of road accident, I feel that it is not being given a priority by the government. The attention is not really, because we have people dying on our roads every day. And look at even our minors. every 4 minutes a child dies from a road accident. And when we also talk about transport and mobility of children is important in ensuring that they have safe access and mobility. We also realize that 1 out of every 5 children and teenagers, they are victims in road accidents. And victims, either they are dying or they are being injured. And we also realize that road safety is a social and equity issue that we all need to address. Our study focus, it was to explore linkage between urban spaces mobility, access, and children's safety in Nairobi and Kumasi. And we were keen to look at the children transport safety policies and regulations. And at this point, I can mention, why were we doing a comparative study? We wanted to learn from one another. We wanted to learn the best practices and also learn where they have not done well. So it was learning from one another. Ghana learns from the best from us, and we also learn the best from us. And we also look at the travel needs of children and their mobility options. We also carried some transport safety audits to map out the pedestrian infrastructure. How was it? Is it available? Was it maintained? And we're also looking at the efficacy of children's safety measures and education programs and provide inter-account learning. And lastly was to come up with options for promoting safe access and mobility for school-going children in Nairobi and Kumasi. Briefly, the methodology of how we approach the study, both Nairobi and Kumasi had document reviews. Like I mentioned, when I was beginning, schools that were covered in Nairobi covered public schools, in Ghana, public and private schools. In Nairobi, we talked to the parents. We did interviews with both parents in low and middle levels. In Ghana, it was in upper primary and junior high school. And Ghana also carried a user perception survey. And we also had interviews with teachers, key informants, FGDs with the children. So just something on policies, like we know in Kenya, there was a directive that all school buses are supposed to be painted yellow. You can see some of that. This is not the same in Ghana. So Ghana picked this as a good practice where we can, or like you see what is happening in Ghana. Not that doesn't happen in Nairobi. We have the tuk-tuk, our case in Nairobi here, we have borders. Border have also come in as a mode of school transport. How it is regulated, it's a question for another day. And now when you look at the urban infrastructure, you can see, these are some photos in Nairobi. This is somewhere along Jogoo Road, around Makadara area. And you realize that there is a pedestrian crossing facility there, the flyover, and you realize that you can see someone trying to cross the road, and yet the infrastructure is up there. So that is a lesson, what goes on in people's minds, in our minds, when we have the infrastructure provided there and we are not using it. And you can also see an infrastructure there, a child is trying to walk to school early in the morning, and you can see how it is. And then you can see a mixture of mukokoteni, we call it the handcart, that in Kenya. And we also have, this is the accompanying that I was talking about. And we also have other pedestrians also in all this. So all these are pictures of what we took during our study and the audits that we carried. And we were calling it, what is the cost of accompanying kids to school? What we call assisted travel. And this is something that we want to do in future so that we see the time that women, because they're the ones who bore the responsibility, of accompanying kids, if this time was used to do other things, and if the government was to come in and provide school transport, then we'll be somewhere. And then a few other pictures of obstructed walkways. Even for us as pedestrians, as mothers, you realize that it is just a big challenge trying to cross our roads. And some safety measures. Ghana has a road safety education. CAT has part of class lessons. In Kenya, National Children's Safety Programs, are they there? How are they implemented? And I have a few videos of promoting road safety among children. You can see some work with Ubongo Kids, African educational cartoons. Sorry, and we also have NTSA. You can see they were launching a road safety campaign in schools. And this is something that we can all pick up. So some of our recommendations: infrastructure development need to focus on student safe travel. We need to have speed calming measures, enforcement of regulations. I always say that regulations is not a problem. We all have the policies, we all have the rules, but enforcement is just weak. How can we all become self-regulated? How can we be self-regulate ourselves? How can we be champions of enforcement so that when these regulations and policies are put in place, we are all able to benefit? Then safe school zone areas should be marked. Traffic marshals, like I mentioned, we had some in some places. Street wardens that are assisting children to cross to school. How about improving safety along school paths? Lighting, you realize some schools, there's no light early in the morning. As early as 5 a.m., kids are at school. You know, there's a regulation that schools should start at 8 a.m., but you realize this is not the case. So issues of security, we had the issues of kids being attacked in the morning by dogs, stray dogs around the estates, the issues of motorcyclists, the border, and all that. So these are issues around with safety along schools paths as kids walk from one place to the other. And even to us as parents, as mothers, how is our safety also taken care of? Then educational programs, they should be made universal and supported by relevant, repeatable policies, including focusing on school neighborhoods. And I think this brings me to the end of our presentation, of the work that we've been doing for the last 1 or 2 years. And when you talk about, I think I already put the issue out there. When you talk about issues of children and caregivers, I said we are the women are the ones who have the biggest responsibility. And how can we be assisted such that we are able to use our time, for instance, when accompanying kids to school, and do other things that are important in our lives? Allow me to stop there. Thank you.
I'm Sam Bambaza, Executive Director and Founder of Hope for Victims of Traffic Accidents, Hovita, Uganda. Thank you.
And now heading over to Uganda, we want to learn more about Sam and from Hovita and all the initiative towards on promoting road safe school zones in Uganda. Over to you, Sam. Karibu.
So I'm Sam Bambaza again, the Executive Director, Hope for Victims of Traffic Accidents. We are a local NGO here in Uganda, and we are focusing on road safety education and victims support, providing legal aid and empowerment of those who have been affected by road crashes. We are implementing advocacy for safer school zones project, which is being piloted in 2 schools in one of the newly created cities of Guru. It's a city located in the northern of Uganda. So this project is funded by Global Road Safety Partnership, Bloomberg. We are piloting it in those 2 schools so that those 2 schools can work as model schools, and later on it will be rolled out to other districts and other cities. The main objective of this advocacy for safer school zones is to reduce the road deaths and injuries among school-going children in Uganda through setting up a speed limit of 30 kilometers per hour along school zones. And to achieve this, we must advocate for the review of the Traffic and Road Safety Speed Limit Regulation 2004 to include the provision of speed limit for school areas, built-up areas, residential areas, where vehicles mix with people, like markets. The current speed limit in Uganda, according to the traffic regulation of 2004, is at 50 kilometers, which is very risky for young children. And also risky for even other caregivers, especially those who escort their children to school. So to achieve this, we are trying to ensure that the speed limit is reduced to 30 kilometers. And research shows that if speed is reduced at 30 kilometers, there are some chances of survival. So it is the process we are in, and the advocacy is in progress. So we are able we are doing this advocacy basing on the data we have collected. Before I go to how we have collected the data for our advocacy, I wanted just to briefly to define what school zone are. School zones are areas within the vicinity of schools and other education establishments where school children and young pedestrians are likely to be present in high numbers. So that's why we are calling it school zones. And we have to do our advocacy, we have been able to use the star rating for schools application, which was developed by IRAP, International Road Assessment Program. And this tool, or star rating for schools, is an evidence-based tool for measuring, managing, and communicating the risks children are exposed to journey to school. So it supports quick interventions that save lives and prevent injuries from day one. So using this tool, we are able to identify risks within those two schools which we are working on. For example, when you look at this photo, you'll see that the road is very wide, and which is very risky for this child. You see this child is now in the middle of the road where it is marked. So this road is supposed to have road island, where a child is supposed to, once he crosses and steps and look left and the other side, so that he can be able to cross to another lane. So we found out that this road is very wide, which puts them at a risk. Two, there is also no crossing supervisor for these children. So these children are at the risk they cross on their own without someone accompanying them, whom we may now term as the caregivers, and even the parents don't pick them from school, and even the teachers don't escort them. So even when you look at this road, this is the road in the front of a school gate. There is no school zone signage. A school zone signage here, I've said that the school zone is an area within the vicinity of the school. We are supposed to have road signage 50 meters before a school gate, showing that there is a school ahead, so slow down for children crossing. Most cases, the signage we have are signposts that showing that this is a property of maybe Kampala school, but it does not show that, or does not warn an incoming person or a new person on that road that there is a school ahead 50 meters before the school gate, so that he can slow down. So when using this tool, we realize that we don't have the school zone signage. The speed limit, of course, now at current level, it is still at 50 within urban centers, and which is also risky for these children. So there are no walkways. When you look on the other side, there are no walkways for the children, and those walkways are supposed to have barriers that can reduce the impact of a crash in case the vehicle rams in these children. So the children are forced to share the main road with vehicles and motorcycles, as you see. I've also mentioned that there is no road islands or road refuges, because like when you look at this child is supposed to have stepped on the road island, look left and this side, so that he can be able to cross this next lane. So using that tool, we're able to rate the risk of the road. And that road now, basing on the star rating tool, is it's rated as a 1 star. These ones are rated for hotels, that this is a 5 star, a 2 star, a 3 star. Of course, like in a hotel, a 5 star is one of the best hotels. So here, this road is a 1 star because a 1 star is which one is the one where the safety features are very few. So that is the evidence we collected that we are using to engage in the decision makers. So how far, this is to show you the progress of the advocacy where we have reached now. You can look at the risk. This is a child crossing this road. They do it every day, every minute, because they fetch water across this side. There is a borehole in the school. So you can see how the road is wide, and it is the main road connecting City Guru to Juba, the capital city of South Sudan. So how far have we gone with the progress in this advocacy for safer school zone in Uganda? One, we have already engaged in key stakeholders in the Nure district, including resident city commissioner, who is a presidential representative in the area. We have engaged in education officers, the town clerks who control the budget, and other authorities, so that they can support this advocacy, so that we can ensure that we have model schools which are very safe. We have also done the data collection, which is done to gather the baseline on these recommendations, which we have already made. Of course, earlier we have already identified the risks, and each risk has its own recommendation. And when you are making these recommendations, you have to make sure that these are affordable interventions. You don't inform the city authorities or the government that they should now construct another road. So it is not affordable. So you have to make sure that your intervention or your recommendations are affordable. And we have also done on progress held during the UN Road Safety Week event in collaboration with our Ministry of Transport. We used this opportunity to inform the authorities that there is surely a need of reducing speed limit along school zones from 50 to 30 kilometers. In the photo here, we took the commissioner, the one who is putting on a mask and a blue suit with children, and took him direct to the front of the school gate. This is a main road in the Kampala, and the commissioner in charge of transport regulation and safety was able to see the risks children go through. Of course, I've not shown the other photo, but the risks here is that there's no zebra crossing. Children are parked on the other side, and then they are supposed to cross themselves to the main gate. Then vehicles park on the front of the gate, which obstructs children when they are crossing. In these schools also, in progress, we have established school health clubs in those two school health selected schools. Here is to educate or to sensitize the children themselves at the risks along the roads, and also to create road safety ambassadors, to train the school crossing supervisors, even teachers, even parents can be also crossing supervisors. When they see that there is vehicles crossing, they should be able to assist children to cross. So the health clubs now, they are going to paint their school walls with road safety messages, so that children, teachers, and parents can be able to have that information. Also, what we are doing is we are engaging in community sensitization. So community sensitization is done to introduce the project and to find out their road safety needs. As I mentioned, the school zones, once the school zones are established, they not necessarily benefit the only school-going children, but also the neighborhood. Because we have the teachers who stays across, we have the parents, we have other suppliers of the food or of the school also who become beneficiaries. And engaging the communities, it means they will be even in making noise, engaging their local leaders, because they are the voters. So we had to engage the communities, to sensitize them the risks and the benefits of having a school zone. Because once you have the school zone, it means it will promote mobility to the markets, to the hospitals, to schools, and even their parents also, they will be safe. The key achievements, so we have already got support from the ministry. Also, we have also got support from the media. We have of recent trained some journalists to cover road safety issues in Uganda. We have engaged in the MPs or members of parliament who are supposed to, so that when the review is in the parliament, they should surely support it. Some of the schools we have worked with are already implementing some of the affordable interventions. Thank you very much.
Thank you so much, Sam. That is super, super interesting. And just to see that you're already working with communities, because schools are not in situ. We have to definitely work together with them and ensure that community are part of the school and the school is part of the community. So thank you so much for that. Without much ado, I want to pass the mantle over to Professor Angela. She's actually a professor of cycling, and I know she's super, super interesting as far as she's so much passionate about cycling, and she's going to be sharing with us how you can actually use behavior change to encourage more children to cycle to school. Over to you, Professor.
Thanks for the introduction. I'm really happy to be here and to share a few insights from a project we did on a training to increase the road safety for school kids. And just a quite brief background of my person. I graduated in transportation economics at TU Dresden, also in Germany, and then I was really doing a lot of research in active mobility and how to promote cycling and walking. So these being one of my main tasks and something I'm passionate about. And I'm also became one of the new endowed cycling professors of Germany. And this is like a campaign to get Germany into a cycling nation. Maybe you think about Germany and having this car in mind, but we actually did and want to improve a lot more, and having active mobility as one of the key factors also to combat the climate crisis. And I'm doing a lot in terms of research, also to have this kind of approach of cycling for all, or active mobility, or at least having the possibility to have sustainable mobility for all, and also how to change behavior. Also, this is something I'm passionate about. How can we have this? And I'm doing this a lot also with the Global South. So that's very briefly. To give you the background for the project I'm talking about, we also had this number, and all the other presenters were also sharing this really horrible numbers. If you think how many kids are actually dying on the roads, and if you think about we have children insured, but if we have the cohort, which is the one who are the most vulnerable in Germany, this is the age group between 11 and 14 years old. And that's why we were targeting a campaign to this age group and looking at them going from and to school, and also would check what kind of characteristics are this. Is it a traffic conflict? Is it a riding error? And can we upscale this knowledge, and make it available for all the others? And what kind of training should we do with the school kids in person to actually see how their behavior changes? So I'm giving you also a bit of the method, because I think it's always important to see, and then also to know, can we use the same method, or how can we target it or tailor it to our own needs? So we were checking really on traffic conflicts and traffic errors and made an observation. And this is together with the colleagues from the University of Kassel, which is Dr. Franz Lamprecht, who was doing the main person doing this research. And we were observing the driving behavior, and this was pedestrian crossing. We had just in the last presentation, that this is also a critical situation, and developed a road safety program based on a method which is called the Mwaura method. I will tell you a bit later about this. We did it in 2 different schools, both grammar schools, and 2 different locations to also see if there are differences, with around 500,000 pupils participating, and also wanted to know if the behavior had changed afterwards, if you observe before training, observe afterwards. Also to give you an impression how a typical German situation can look like. It's all like a bit clear now. It's taken during Corona. Yeah, no one was really on the road, as you can see, to give you an impression of a zebra crossing or a normal residential road or a normal junction with the tracks of a tram, or to give you like a bit of a detail how this looks like. Yeah, and we've chosen these different situations for the analysis and had about 3,000 road users recorded in these 7 different situations. We then came up with the road safety program. So you had the surveys before, the observations before to know, okay, what's the status quo. Then we did the training. I will show you how this worked. So the school kids were watching videos, and they had this kind of, I can't really use it with the camera, I think, this kind of leaves where they would fill out on the situations, how they perceive the situation themselves, and if they think it is dangerous, and if this, how this, your own behavior could influence this. And then we're doing this workshop, the teacher would do it. Yeah, their teacher, they had already trust to. And then there was an afterwards survey. And I brought you 2 videos of this situation. Those 6 were chosen, and which are like the most critical in this school situation. And with these videos, the kids were like putting themselves in the situation and reflecting on them like in a mirror. Yeah. So I will play the video now to give you the impression. It's working, yeah. Okay. So you see the school kids passing here. Which is a normal situation. 1 on the road, 3 together. The one is still going there. They are talking to each other. Yeah, on the way to the school. But the kids would watch this, and then they would work in silent. Yeah, they would write what was in the video, what was strange for you, or what happened to you when you watched the video. And they would recognize, yeah, I would, if we had more time now, yeah, I would do it with you actually directly, because you would not notice, they were going on the pedestrian way, not on the road, the cyclists. And we were looking at each other, and then the attention were gone from the intersection, and there was a car approaching. Yeah, so this is actually a situation where you could we put them classes. Yeah, and they were in the classes, and they actually forgot they were wearing these classes. This is very impressive. Yeah, but then we could actually see what they be on the road, and to come up, okay, what kind of interventions do we need to improve afterwards? And I also give you another situation, another very typical situation at an interjunction with bus, tram line, and you see the school kid crossing and another one crossing by bike. So a typical morning situation, and then yeah, you see them both cycling, and then they actually turn directly on the road. Yeah. Which also means, and you see they are turning a lot their heads, yeah, like even double checking again and again, because it's quite dangerous, and they should have dismounted here. Yeah, this would be the correct behavior in this situation, but of course, yeah, you know how it is. And then it can happen that there are some critical situations coming up. This to give you a situation, though you have different videos for all the situations. And you see that because of division like this, the kids would notice, this is a mistake, or maybe could recognize what should be changed. To give you a short, like very brief overview of the results, because they were really impressive, we could see that the number of conflicts in the before and after setting, and also of driving errors in the before and after setting, actually were cut in half of the group who did the training. And it's actually really also impressive to see, okay, we had the training, it was just a 90 minutes situation in the lecture, yeah? And it actually had such a good effect. Of course, we need to now look if there's also long-term effects, yeah? And we also had a control group, of course, yeah, who weren't doing the training to see if there are differences. And we could also see that in terms of the relevant driving errors, they reduced really in this subject group and the group who had the training. Yeah, they were using weren't using the wrong side of the lane anymore, or they weren't crossing without dismounting anymore. So this actually helped a lot. And to sum up, with some recommendation also to think about to upscale. Yeah, we were talking with the Ministry of Transportation in Germany how to integrate it now in each school, and to have the ideas. Okay, what are the success factors of such a program? And I think it is a way to improve the safety, yeah, of these cyclists. And because in Germany, yeah, we really want them to go alone. Yeah, you're not. It's from the very, very young age you train them in kindergarten to go alone to school. Yeah, to have this also as a way of self-confidence. Yeah, as being alone into traffic and being able. And I think this should become a permanent part of school lectures, not only in one class, but maybe as a permanent. Every 2 years you have you have different ideas. Maybe using the smartphone while you're cycling. Yeah, is also some kind of distraction. And it could be targeted to the way where you put it in place. Yeah, you have all the critical situations observed, but then you select these 3 main situations in your school surrounding and actually train on them. And this could also be dependent on the local situation. I think it's not only like narrowed down to some German junctions. I think this is some situations, as we saw in the other presentations, which could be deployed everywhere. So thanks for your attention. I'm really happy also to hear from you and maybe also to develop something together. And I'm really happy for the invitation to join this panel today. Thanks, and I'm giving back to Penina.
Thank you so much, Prof. Angela. I'm so fascinated by the new methodology, like just having the kids sit down and watch their videos and really remember how their journey was to school. I think that's really interesting. And definitely, just even to ask the audience, how many parents or how many people actually in the audience do encourage their children to cycle to school? Personally, I don't, because we don't even have the infrastructure like safe cycling network. But I think that's a really good challenge. And even as we work along Safe School Zone, we also have to make sure that our children are more independent. I'll call upon Owen to take us over through the presentation. So Owen is actually the head of research, head of transport in WOMAM, but he's also a researcher at UCT, and he's going to introduce himself and also carry on with the presentation. So thank you. Carry on, Owen. Thank you.
I am a researcher at the University of Cape Town, the Center for Transport Studies. I work with a number of affiliate organizations within that Center for Research, and I'm grateful to have this opportunity to represent WOMAM. Yeah, so my background is on urban and regional planning. I have done a postgrad on geographic information systems, and currently in the civil engineering department, studying and researching on urban mobility and transport studies. Yeah, and my interest in the WOMAM is just mobility and having an inclusive mobility for Nairobi. And the interest, it's quite fascinating, and it's one of the people that we haven't really looked at. And these are the small kids, the ones that are under 5 years, 3 years. Those who can't walk, those who really need the caregiver to be with them and support them and take steps with them as they traverse the transport system. Yeah, so my slides kind of introduce what WOMAM does and some of the focus area of WOMAM, and that's basically designing cities where children can grow and learn. Nutrition, having child-friendly cities, but the focus of this presentation is just how and what is the experience of a caregiver who has an infant. And I've put some definitions here, and they really focus on the infants, the newborns, to those who are starting to walk. And this picture here kind of presents the experience of a mother who has a really young kid, and They are in a transport hub, and what they have done here, and what we can see is that the mother decides to actually pay for 2 seats so that they experience comfort, so that they can experience some level of ease as they sit in that matatu or that vehicle. And my thinking as I look at these pictures, they have paid more. Yes, they have paid more. They have gone an extra mile. Although they are dependent on this system, they have gone an extra mile to pay for extra, and they are transport captive. They are public transport captive, so they don't have another option. The difference between them taking an Uber is probably that cost of having to sit in an Uber, where you pay probably double or triple the price of booking 2 seats. So they prefer to do this in order to have an easy and a better experience when they're in the transport system. So we'll be looking at that and sharing the experience and trying to see what really is the approach and what kind of mind-changing approaches can we have in terms of making the public transport more easy and accommodate the caregivers, especially the ones that have infants. So I'll be presenting on transforming mobility, urban mobility to nurture early childhood and development in Nairobi. So there are four main focus areas when we're looking at ITC, and that is the green spaces. They need to be in places that are accommodated. Coaching. What kind of mentality do we need in order to be able to influence the operators, to influence government, to influence even the citizens themselves, to know that if you see a caregiver, this is a kind of treatment, this is the kind of environment that they need in order to thrive. So I'll be focusing more on the mobility of the caregivers and the infants. And we'll see the experience both from all the way from all the spectrums of transport, from the public transport itself to non-motorized, to walking. And when you look at this, from what everyone has shared, there's the actual need. They actually need to, caregivers need to access this facility. They need to take their infants, or even those kids that can go to a daycare, they need to go to school either by walking if they are near the schools. They need to work with even other smaller kids or even older ones to access healthcare. They need to access childcare and even this recreational parks. This photo shows an experience of kids walking from school. They will walk, they will be playing around. And the question is, what kind of facilities are there? What kind of safe zones have been put for them in order to make sure that they have a safe walk from school? And if we look at it and comparing with the previous presenters, it's kind of a different context. It's different. The kids here will not be cycling, they will be walking. So what kind of walkways are we providing? Are they safe for them to be jumping around? Are they safe for them to actually be able to assure the caregiver that they will be able to get home safely? So those are the kind of questions that, as WOMAM and as a researcher, we've been asking in our endeavors in trying to answer some questions that caregivers might have, or which might be an impediment for them to actually decide where to place or where to take their kids for school, for all these facilities or all these utilities that they might need. And this photo shows a father or a caregiver who has decided to take it to his hands and put a put a kid on a bicycle, and you can see the experience here. He's probably sharing a walkway with a walkway that also has vehicles. You can see vehicles on the far end, and it's a mixed use, or it has multiple modes on it. And my thinking is this is the option that they have. This is what they are presented with, and how safe is it? How comfortable is it for the kid? How easy is it for the kid to be seated on that bar and be able to get to whatever utility they are, whichever facility they are going to? And then this is a matatu experience for a mother. And as some of the presenters shared, we can see that the mothers really have to sit in these quiz spaces. That is, if they're not able to secure a better seat, or probably the front seat, they have to squeeze themselves in this kind of facilities, or this kind of vehicles. So our thinking and our approach in this is just changing the mindsets of the operators, of the people involved in the public transport system, or people, or stakeholders that would benefit from capacity building in terms of what kind of facilities do we need to put for such caregivers. Do we need priority seating? Do we need to secure some space in case such a situation presents itself, where a mother has a kid, and is there a special dispensation for such facilities? And from this, the gaps that we've seen is that there's some basic needs that in caregivers that they need. And part of what Mwaura has been doing is actually coming up with some facilities, such as changing stations, water facilities, and utilities that solve the basic need of a caregiver. And the second thing would be how does this space interact with these spaces interact with between the caregivers and others? Is it dedicated seats? Is it dedicated spaces for caregivers to be able to have ease of movement? Can infants, or even kids that are being transported through the system have a better experience? And then the comfort. And this is where we basically trying to motivate and trying to build a lot of awareness. Is it accessible? Is there sitting space? Is there priority sitting for caregivers? And then the protection of this. Is there lighting? Is there safe signage in creating awareness that these spaces are used by the caregivers? So looking at all that, then the approach that we are basically researching on and looking at is it's more of a transport approach, where we have mixed use development and putting up non-motorized transport facilities and priority sitting places for this need, these specific needs, or even branding specific seats for specific purposes. The costing and the costing of all this could be a matter of other discussion, but yeah, this is the awareness that we are creating and trying to motivate to actually change the mindset of operators. So we have different target groups, and we think that these groups could be stakeholders in this and could be beneficiaries of the same. And this is the infants and the caregivers, the operators. There's need for them there's need for awareness to be created in terms of how they handle caregivers and infants. And there's also a need for academia to be involved in this research. And we know that academia has a lot of input into policy. Some of these policies that we have been implemented come up from academia. Academia has been involved in informing such. The public sector itself, building capacity in organizations that are affiliated in public transport, is need for that. And then the citizens just creating awareness. If a certain situation allows for individuals to be allowed to sit in certain places, then citizens, there's need of creating awareness among citizens that there's this need. So the project outcomes is basically a project brief, and this is a policy brief that shows such a design of such facilities. And there's also need to build capacity in terms of how do people relate when these facilities are provided, how would people interact with them, how would people be able to relate to these facilities. And as we've seen, is an incremental process. We must build the infrastructure and then build capacity for it. And then the toolkit, that is to inform policy, to inform organizations that are affiliated to public transport on what needs to be done in that aspect. So that is basically what we are doing in that sector of WOMAM, and it's quite interesting for WOMAM. It is involved in a lot more, but in terms of transport and the relationship between it and caregivers, we're basically working on that and coming up with a toolkit that will support decision making. And this toolkit will be a data-driven one that involves a lot of data collection, that involves a lot of decisions that need to be backed up by data. And yeah, so it's a great endeavor, and we are excited to be part of it. So yeah, thank you so much, Penina, for the opportunity. If you want to reach us and support us, Penina, our director, will have provided our contacts there. Thank you so much.
Yeah, thank you so much, Owen, for that insightful presentation. I do believe, I'm a strong believer that children need to be included when they're planning and designing their cities. And now I want to take it over to Play Africa, led by Gretchen, and they're going to share with us a toolkit on how we can be able to design more inclusive cities, but making sure that children are part of our stakeholders, because they do have something to offer. And over to you, Gretchen, and looking forward to hearing from you.
Thank you so much. My name is Gretchen Wilson-Prangley, and I'm the founder and CEO of Play Africa. And Drico, who's presenting with me, will be sharing our screen. Play Africa is Southern Africa's pioneering children's museum, which responds to the critical needs in our context here in South Africa. UNICEF estimates that 71% of children in South Africa do not have access to safe play areas. And we know that every child deserves play and to learn and develop critical skills through play. So we at Play Africa reimagine how Africa's cities can be transformed to better serve children and provide more of what they need to grow up happy, healthy, and ready for life. We create shared spaces for play and learning. We also call ourselves an education makerspace. We're a research and development engine of scalable innovations, and specifically within an African and low resource African context. We transform existing public spaces for playful learning to empower children, to bridge divides, to inspire parents and educators, and to build social cohesion in our divided society. We're committed to bridging opportunity gaps and leveraging public spaces to invite children to participate in city life, to be seen, heard, and valued as full citizens and important residents of our city and other cities. And we see them as children, as individuals with voices and ideas that matter. We believe public spaces can and should be transformed with and for children in our urban contexts here on the continent. In the last 4 years, to give you an idea of our work, we've turned public spaces into playful learning spaces and have reached meaningfully with multiple hour interventions, 35,000 children, parents, and educators. And we've reached hundreds of thousands of more with our scalable programs. We go to where children are and do so offering free access in partnership with 245 schools and NGOs. And our approach to community partnerships is really something that makes us one of the most inclusive museums that we know of in the world, transforming these existing public spaces to serve children as well as their play and their learning. We're disrupting the very idea of what a museum can be. Part of our mission is to create playful African cities that support children's development. And our placemaking programs center children's participation in the transformation of their communities and cities. So we ask, how can we make Africa's cities, including Africa's transportation systems and mobility, safer, more playful, and more child-friendly? The challenge for us is something that we all have discussed. Africa is uniquely positioned, however, we believe it's uniquely positioned to be the source of innovative solutions, especially that those that consider the needs of children and women. And I'll tell you why. First of all, Africa is the world's youngest continent, and we believe that the time for Africa to contribute more to these global conversations that are being had has never been better than now. Children under the age of 15 make up 40% of our total population on the continent. And our continent is so rapidly urbanizing, crowding cities that were never built for this kind of population boom. So with many countries and cities still in the healing phase of the post-colonial condition, the strain is being felt. By 2050, 40% of the world's children under 5 will live in Africa, and its urban population will triple, with another 950 million people crowding into our already crowded infrastructure. So for us, this is a real strong signal that right now, the time is now for Africa to be best positioned to develop new solutions that focus on children's needs that can be replicated around the world. Many people know about South Africa's legacy. In our context here in South Africa, our inherited colonial legacy and the rapid pace of urban sprawl means that South Africa, like many African countries, faces mobility challenges. As discussed in different contexts throughout these presentations, many communities are still underdeveloped with few resources and placing a high demand on motorized transport to access jobs, education, amenities, healthcare, and other services. And a lot of the spatial planning continues to consist of singular major arteries leading in and out of overcrowded and low-resourced areas, resulting in intolerable congestion, unpredictable travel times, and environmental degradation. And our transport systems still, by and large, replicate systems of exclusion, which adversely affect women and children. Most of the country's motorized transport users rely on minibus taxis, and their unregulated nature presents many different challenges, including unlicensed vehicles and drivers, reckless drivers, fluctuating taxi fares, sexual and other kinds of harassment. And walking pedestrians face increased challenges, especially women and children, with insufficient sidewalks or pavements, insufficient pedestrian islands, high rates of pollution, and myriad other safety hazards. So with that, I'm happy to hand over to my colleague, Zwiko Kanyoka, who's going to walk through one of the solutions that we've developed to reimagine new possibilities. Over to you, Zwiko.
Thank you very much, Gretchen. In efforts to empower children's participation in urban placemaking, Play Africa embraces design thinking. Through hands-on workshops, we center children's experiences, feelings, and needs. We help children learn how to identify social challenges, ideate, prototype, and test possible solutions for safer, more playful communities. This ensures that children's voices are heard and they feel that their existence and views of the world around them matter. Our process is centered on what we call our image of the child. We see every child as curious, strong, and full of potential, as full and complete citizens with the capacity to solve problems and identify new solutions in placemaking. Through our co-design process, we can help communities create spaces that are designed to support how children learn, creating environments that foster play and playful learning that is meaningful, joyful, socially interactive, actively engaging, and iterative. We see every child in Africa as a change maker. By inviting children to actively participate in designing better cities and communities for kids, we create opportunities for them to develop the critical skills and hands-on experiences they will need to thrive in the future. These include skills such as collaboration, communication, critical thinking, creative innovation, confidence, and content. We have tested this approach with hundreds of children in low resource settings across South Africa. We want every child to have this experience, and as a result, we have created a free, open source, and virtually accessible toolkit so anyone can adapt our design thinking workshops to focus on children's needs. This adaptable resource offers an African perspective and is a contribution to global placemaking resources. In testing this toolkit in a range of African settings, we've proven that involving children in designing more playful communities is both possible and powerful. As you can see, we are passionate about creating playful learning landscapes. Every child has the right to play, learn, and grow in communities that support and value their unique needs and offerings as children. We're excited to have embarked on a new three-year project to roll out our Designing with Children approach across sub-Saharan Africa. This will ensure that thousands more children are empowered with playful learning landscapes that can help nurture their fullest potential. On this three-year journey, we will be training educators and community leaders on how to use Play Africa's toolkit. We will also be leading workshops to serve 1,200 children directly. Trained partners will also receive support from Play Africa to reach an additional 1,200 children across Africa. Due to the high unemployment rate, Play Africa also aims to equip unemployed young people with skills to implement design thinking workshops with children. We're excited to share that we have successfully sent out invitations for applications to our first cohort of fellows for this program. We look forward to processing the 84 applications we have received over the past 1.5 weeks and connecting with more passionate individuals and organizations as we phase in the program over the years. Through this work, we're creating openings for new ways of innovating for African mobility issues. Our approach to centering children in development agendas is transformative for both urban landscapes and their public transport systems too. It can help make cities more livable, greener, and walkable, while also advancing critical development agendas. Together with Play Africa, cities can create new infrastructure, including transportation infrastructure, that incorporates playful learning activities into shared spaces. By considering children's needs, we can bring play and playful learning into transportation, meeting children's developmental needs and supporting the quality of life of families.
Let me ask, can you make Nairobi one of the cities to test? We are here, we are happy to definitely see how we can definitely work together. And yeah, I'm super excited. So we've come to the end of our session. And as you can see, there are so many things revolving around children and their caregivers. And these are just a few that I could be able to sample for this specific conference. But from school mobility to infants and toddlers to behavior change to actually designing with children, I cannot wait to see whether some of you as participants applying some of those methodologies or toolkits that have been presented, or even ideas to make sure that your cities are more safer and more convenient for children and caregivers. Before we wrap up, I think I want to call up all the presenters to give us 1 minute, not 1 minute, because we don't have that much time, but just one last word, just to challenge the participants.
Thank you. I just think that it's such an opportunity that we have here on the continent to be reimagining new possibilities. And by putting children in the center through designing new transportation systems and thinking very differently about mobility and their experience as children, I think we can come up with some very innovative solutions that would be replicated around the world. And happy to engage with any participant who's interested in learning more about how we would do that.
I think I share similar sentiments with Gretchen. I'm also excited to see the opportunities, how we harness the opportunities to innovate in Africa, because clearly there is great opportunity to expand beyond where we are right now. And we do have a context that presents opportunities that are unique from anywhere else. So I look forward to people that are interested in partnering with us.
Thanks for this very interesting session. And I think one key takeaway is also to learn from each other, also within the continent, but also, of course, within all the continents, because I think we are all struggling and we are all having the same challenges. It might seem very local, but actually you can scale it up and you can think about a lot to learn from each other. It's in both directions. And we have a saying in German, and it means what the little Hans is not learning, Hänschen, like the big Hans, will never learn. So we have these users from tomorrow, which are actually now starting to form a habit on how to move around. And if the habit is to always get a private transport and to have an Uber or whatever, then this will continue. But if the habit is to be active mobile and to have it enabled for everyone to have a safe and comfortable getting from A to B, I think this is something we should all strive for.
Thank you very much. It was very interesting interaction. In Africans say a child who doesn't visit says that the mother cooks very well.
Yeah.
So it is very interesting to learn from each other, and I see the future of our African children with this innovation, with these researchers. I see the future of African children, and you always invite us whenever there are some opportunities like this to participate, and also as well to do networking. I'm always available, and also very welcome opportunities for replicating these kind of projects in our home country, and also to learn each other. I was very grateful to learn about what Play Africa does. It's surely interesting, and Kenya, I did some training, road safety advocacy in Kenya. I was remembering Owen when he was sharing those photos. I was remembering those schools. Thank you very much.
Thank you so much, Felina. Key takeaways. In the same breath, transport justice is very important. Inclusivity is very important. And if we look at all this, this is a great future for a community that understands the importance of having healthy and well-guarded facilities that promote early childhood development. So what some of the presenters presented on design thinking, I think that is something that can be done across everywhere, and it's a very problem specific, it's very context specific way of thinking about a problem, and I believe that would be a great initiative to carry through, even in Germany, even in Uganda. Yeah, there's great insight, and we're in a paradise. So let's take advantage of it and come up with the very innovative solutions that will give us the chance to have a better community and a better life for the kids. Thank you.
Thank you so much. And thank you so much for being here. I'm really excited. It's been a very learning opportunity for me, and I hope the participants too. So for me, I keep saying that children are an indicator species. If you cannot see a child in the city, just know that that is not friendly for them. And if children are not designed for, then they're designed out. So we really have to be so intentional about including them in the design process and actually designing for them, you know? So thank you so much for being here, and I'm looking forward to get us answering the questions from the Q&A. Thank you very much, and see you soon next year, hopefully.